Hello guys, good morning. It's been a long time since I came up with a video. I've been planning to come up with this series from a long time, but I think as we are approaching the end of February, this is the best time to upload this video. I have been busy past 2 weeks. I took some time off. I was on a vacation with my high school friends. It was nice. So yeah, here goes this series, as I would like to call it, MIT, most important topics. And I'm planning to post this in 4 parts. So today was the first part, and first part will comprise of OBGYN, PSM, surgery, and medicine. So I'm sure you must be already aware that these four subjects form a huge chunk of your upcoming FMG exam. If you have followed the recent trend, I think around 35 to 40 questions have been asked from these four subjects. 35 to 40 questions each. So I assure you, if you pay attention with me for the next 20 or 30 minutes or so, you're going to you will run down through the most important topics of these four subjects, which will guarantee you your 120 marks in your upcoming FMG exam. So I'm doing this just so that all my juniors, all my friends, and everyone who is watching this video pass their exam in their first attempt. And I'm going to do this for all 19 subjects. This is the first part. I think I'll take all the minors together, all the 5 mark subjects together. And then in one episode, I'll do the Prof 1 subjects, and in second episode, I'll do the Prof 2 subjects. So that's how I planned it. So yeah, without wasting any more time, let's start. So before we start, I want you to focusly study for at least 6 hours every day. And when I'd say 6 hours, this 6 hours should be you one on one with your source. You should not be having your cell phone around. You should not read for like 20 minutes and then get back to Instagram and YouTube shorts and whatever reels that you've been doing. So yeah, just cut that off for next 3 months, and focus on your exam. Your exam should be your priority, because these 3 months will either make you or break you. And then yeah, adequate breaks. See, adequate breaks is very much important. I don't want you to overwork yourself and feel pressured. uh, you should study and you should take breaks also. So half day off every week, like it should be your break. You're not reading anything, maybe you're watching a movie, maybe you're out with your friends, whatever, but you need adequate breaks to be functional. And exercising, eating healthy, and taking a good sleep is very important. See, if you have a messed up body clock, I would suggest you to start fixing your body clock right away. And the most late you can sleep is maybe 1 a.m. or 1:30 a.m. Don't get used to sleeping at 4 a.m., 5 a.m. in the morning, and then getting up at 11, and then don't do that. If you're on that path right now, I would suggest you to fix your body clock right away. So the first subject is obstetrics, obs-gynae, and I have divided this in obstetrics and gynecology. So as we all know, it's very important, and it's comparatively easier to score in obs-gynae than in medicine and surgery. That's what I felt. So yeah, the most important topics are postpartum hemorrhage. You can read the definition, causes, management, placenta, the different types of placenta, abnormalities, the placenta accreta, increta, purcreta, and then retained placenta, retained placental bits, which is the most common cause of secondary BPH and whatnot, and placental delivery and uterine inversion, everything. RH incompatibility, everything about it. Then twin pregnancy. I think this was the question in the recent FMG exam. If uh, the twin is separating in between 9 to 12 days, what kind of pregnancy, what kind of twin pregnancy it's going to be. So yeah, twin pregnancy is very much important. All the signs that you see in the scans, T sign, lambda sign, very important. Molar pregnancy, partial mole versus complete mole, their karyotypes and the appearances, it's very important. Your gestational trophoblastic diseases, your antepartum hemorrhage, its definition, its causes, placenta previa, abruptio placenta, vasa previa, which is painless, which is painful. See, these will form the root of your questions, and this will help you solve your questions easily. Then pregnancy-induced hypertension, its pathophysiology, hypertension in pregnancy, pre-eclampsia, eclampsia management, pre-chart regime, everything. Gestational versus overt diabetes, IUGR, cardiovascular diseases in pregnancy, abortion, the updated MTP rules, and then medical and surgical abortion, and then different types of abortion, the missed abortion and whatnot, missed, and then complete, incomplete, inevitable. So yeah, everything about abortion is very important. The preterm labor, its definition, its causes, prediction, tocolytics, lung maturity, how do you assess the lung maturity, everything. Stages of labor, presentation versus presenting part, engaging diameter, everything. Malpresentation, different maneuvers like Burns, Marshall, Pinards, love sets maneuver, the extended arms, extended legs, everything. Female pelvis, its diameter, types, and images. I think this was also the recent January Fmge 2023 exam question. They gave you a question of the pelvis, and it was anthropoid pelvis. Contraception, sterilization techniques, fetal surveillance, ectopic pregnancy. So these are the topics I want you to focus on your when you're reading your obstetrics. Now we'll talk about gynecology. So PCOS versus ovarian hyperstimulation syndrome. This is like the examiner's go-to topic, favorite topic. They always try to, trick you into believing that it's OHSS, but it's going to be PCOS or the other way around. So yeah, make sure you have your concept straight. Test for ovulation, endometriosis versus adenomyosis. This is also one of the favorite questions. The fibroids, its types and different type and management of fibroids. And then this is very important when it comes to gynecology. You will have a big case question. You have to assess what stage it is and how to manage that cancer. So carcinoma cervix, carcinoma endometrium, carcinoma ovary. You have to read their staging and their management, and abnormal uterine bleeding, its causes and its management, Mullerian abnormalities, imperforate hymen, everything. Next is uterine prolapse and stress incontinence, PID, infertility, vaginal infections, amenorrhea, primary and secondary amenorrhea. So when you sit and read for your gynecology, make sure you don't miss these topics. Now we'll talk about PSM. See, PSM is also one of the most scoring subjects, but it's also one of the most boring subjects. And see, me, I personally loved PSM because I would score well. So if you find PSM boring and if you don't wish like reading PSM, I would ask you to somehow develop your love for PSM, because this is a subject which will help you to score above 100 in your paper one. So, talking about the important topics in PSM, I want you to read epidemiology, the cohort versus case control, and randomized control trials, and clinical trials, and theories of disease causation, that McMahon and Pug, and everything. So, yeah, that's important. Health and diseases, PQLI, HDI, levels of prevention, ICD 11, types of cases, that index case, and whatever, whatnot, and then carriers and types of epidemics, surveillance, very important. Uh, this is one of the examiner's favorites, vaccines and cold chains. So different types of vaccines, the national immunization schedule, cold chain maintenance, and then talking about the preventive obstetrics, pediatrics, and geriatric. Very important, most favorite. Antenatal visits, postnatal visits, MCH indicators, school health, school vision screening. What are the levels of school vision screening? Very important. Malnutrition indicators. Talking about demography, demographic cycle, all the various definitions, what's the denominator in each definition, and the multiplier, if it's multiplied by 1000, if it's multiplied by 10,000. So you need to get your concept straight. talking about all these ratios, data collection system, child women ratio, everything very important. Screening, the lead time, and screening and diagnostic test, sensitivity versus specificity, precision versus accuracy, very important. Talking about nutrition and health, so protein, it's how to assess the quality of the protein, how to assess the quantity of the protein, examiner's favorite. The daily allowances for various minerals, and then nutritional deficiency, and then yeah, this one, food adulteration diseases. If you read the table of the five adulterants and the disease they cause, I guarantee you you're going to secure your 1 mark for the upcoming exam. So yeah, one question is definitely asked, be it FMG, be it NEET PG, they always ask one question from the food adulterants, so read it. And then social sciences, the theories in sociology, Kupuswamy socio-economic status scale, health economics, your GDP, NDP, GNI, NNP, and then environment. See, this is also one of the favorites: water chlorination, Horrocks apparatus, fluoroscope, bacteriological indicators, air quality, waste quality, everything. You need to read it. International health, the WHO, UNICEF, and then the international labors, and then food and agriculture organization. So yeah, you need to read where their headquarters are located in, what year were they formed, what year were they functional in. This is very important and one of the favorites. Health and communication, the differences between lecture, focus group discussion, panel discussion, symposium, workshop, demonstration. I think demonstration was one of the question in the January exam. Funnel graphs, spikes techniques, gather approach, very important. The healthcare system, the three levels of healthcare, and then population norms, and then PHC subcenter types, and then the workers, they are very important. What are their minimum qualification, for how many population are they posted in, when are they paid incentives. uh, these are very important. Your ASHA worker, your USHA worker, your multi-purpose worker, male and female, what are they responsible for, village health guide, Anganwadi, this is very important. The four A's and eight elements and four pillars of your primary healthcare, very important. They can ask you what accept question for these elements and four A's and pillars. So you need to read it. Family planning and contraceptions, the couple protection rate, eligible couples, pearl index, barriers, condoms, diaphragm, sponge, IUDs, COCPs, Mala and Mala D Saheli, depot formations, DMPA, sterilizations, very important. And then health planning, allied in health planning, all the different committees, Bhor committee, Jangalwala committee, Kartar Singh committee, Srivastava committee, what did they recommend? It's very important. Allied health disciplines, your biomedical waste management, disposal methods, occupational disease. The pneumoconiosis topic is very important. They either ask you in from PSM or from pathology, but they definitely ask one question from pneumoconiosis. And then lead poisoning, the ESI Act, triage for disaster. Triage is a topic they can ask you from surgery or from PSM. So very important. Your communicable and non-communicable diseases. In biostatistics, they usually ask a lot of questions from biostatistics. And following the recent trends, these are the important topics that I came up with. So when you read biostatistics, make sure you don't miss on variables classification, measures of central tendency, your normal and skewed distribution. In skewed distribution, they even ask you the right skewed graph and the left skewed graph. If you have solved a lot of mock tests, you might be aware from this topic. And then statistical errors, statistical graphs, random sampling, very important. The national health programs of India, major schemes and initiatives, all their logos, what population do they target, what do they offer. It's very important, and they usually ask two or three questions from. They just give you the logo and they ask you the question, so you need to read it. Now we move on to surgery. I'm sure this must be one of the favorite subjects of many of you. I love solving surgery, and I'm sure you like surgery also. And surgery, it's very easy, it's very scoring. You just need to get your concept straight. And my source for surgery was Dr. Vineet from MIST, and yeah, he's like one of the best surgery faculties for FMG. I'm sure whatever source that you follow, if you have your concept straight, you can answer most of the questions. So in surgery, let's talk about GI first, gastrointestinal. In gastrointestinal, I want you to read your congenital diaphragmatic hernia, your GERD, and then diffuse esophageal spasm, nutcracker esophagus cancer, and then Schatzki's ring, Bohr-Haave syndrome. Okay, that's a spelling mistake. Sorry, I was just preparing your this PPT in the morning. So if there's a lot of typo, just ignore it, please. And then peptic ulcer disease, and then uh, dumping syndrome, and then your gastric carcinoma, pyloric stenosis, Meeker's diverticulum, acute appendicitis, Hirschsprung disease, diverticular polyps, all the syndrome of the polyps, and then carcinoma colon, Crohn's versus ulcerative colitis, intersusception, volvulus, hemorrhoids, fistula in ano. This was the question in the recent Fmge exam, the investigation of choice for fistula in ano, and it's MRI. I made a mistake there, but MRI is the answer, and I'm never going to forget that ever again. And in hepatobiliary, I want you to focus on amoebic liver abscess, hydrated cyst, and the water lily sign, and then hepatocellular carcinoma, and then portal hypertension, and gallstones, cholecystitis, acute and chronic pancreatitis. This was also one of the questions asked in the exam, the January exam. Answer was acute pancreatitis, pancreatic cancer. So yeah, very important. Talking about neurosurgery, I want you to focus on adult polycystic kidney disease, horseshoe kidney, duplication of ureter, bladder stone, BPH, hypospedia, epispedia, posterior urethral valve, phimosis, paraphimosis, uh, Peyronie's disease, undescended testis, testicular torsion. Very important, examiner's favorite. And then talking about general surgery, breast is one of the most favorite topics from for the examiner, and they usually ask you about the nipple discharge. They give you if it's a bloody discharge, if it's a serous discharge, if it's a green discharge. So you have your differentials for different type of discharge. So you need to memorize it well. And then carcinoma breast, about mammography, a phylloid tumor, fibroadenoma, the popcorn calcification, Zuska's disease, very much favorite of the examiner. And in thyroid, they usually ask you about the thyroglossal cyst, which is in the midline, which moves with deglutition. So you need to memorize everything about it. Your various thyroid scan, your system scan, and then your hot and cold scan. Graves disease, thyroiditis, thyroid carcinoma, the follicular and papillary, your orphan Annie eye, your many samoma bodies, so yeah, everything you need to memorize it well. And then uh, trauma is also one of the most favorite topics for the examiner. They usually ask you all the different types of intracranial hemorrhage. I'm sure you must have memorized them really well by now, but still, if you haven't, you need to memorize the age group. And then like subdural is usually affecting this one, either they are very young patient or either they are elderly patient. So yeah, that way you can narrow down your diagnosis. And then extradural has the it's egg shaped, and then the lucid interval is seen in EDH. So yeah, you need to memorize those really well. And then abdominal trauma algorithm, if the patient is stable, if the patient is unstable, uh, fast and extended fast, everything you need to memorize it well. And then these are some miscellaneous topics, which is also examiner's favorite. They usually ask around these. So it goes like burn is one of the favorite topic. There you need to calculate the fluid required using the Parkland formula and whatnot, ALTS and Parkland. Yeah, so you need to get that concept straight. Now, hypertrophic scars versus keloid aneurysms, DVT, Warthin tumors. Yeah, these are also important topics you should not miss on when you are reading a surgery. And now I'm going to discuss the last subject for today. It's internal medicine. See, I'm going to share something personal. Internal medicine was not one of my easy easier subjects, but yeah, I was able to do not that bad, but I was not exceptionally well. So yeah, if you are also like me, if you're weak in IM, make sure you don't miss these topics. That's the least you can do. Okay, so talking about CVS, you should focus on ECG, dilated cardiomyopathy, aortic dissections, angina, and then myocardial infarction, murmurs, and rheumatic fever, infective endocarditis. When talking about rheumatology, you can focus on systemic sclerosis, rheumatoid arthritis, gout, SLE, Sjogren's, sarcoidosis, Behçet's disease, everything. Uh, when talking about renal, you can focus on nephrotic versus nephritic diseases, your acute kidney injury, good pastures, lupus nephritis. In respiratory, you can focus on pneumoconiosis. Pneumoconiosis, it's very important. They ask you from PSM, they ask you from pathology, they ask you from medicine. Very important. Pneumothorax, pneumomediastinum, pneumonia, pulmonary embolism, ARDS, COPD, asthma, bronchiectasis, cystic fibrosis. Very important. Neurology, EEG, epilepsy, GCS, aneurysm, headaches, types of headaches, Arnold Chiari malformation, stroke, neurosensory psychosis, meningitis. There's a meningitis table which divides it bacterial or tubercular or viral meningitis. That is examiner's most favorite, and one question is always asked. I think in June 2022, two questions were asked from that table. So make sure you read that, and then your Guillain-Barre syndrome, your Duchenne versus Becker's muscular dystrophy. In endo, I want you to read on Sheehan syndrome, acromegaly, diabetes mellitus, thyroid, Addison's, Conn syndrome, men 1, men 2, men 2A, 2B, very favorite. Talking about liver, your hepatitis, hydatitis, and ascites should be very important. NGI, see, these are some of the overlapping topics, but I want you to read them anyways. Zenker's diverticulum, achalasia cardia, esophagus cancer, diffuse esophageal spasm, sigmoid volvulus, Crohn's disease, very important. Malabsorption diseases, very important. And in hematology, you should focus on all the leukemias and lymphomas, and Hodgkin's and non-Hodgkin's and Burkitt's lymphoma, all their translocations and their age groups that they follow. And then in AML, it's very important where the OR rods are seen, M3, which one affects gums, M6 and M7, which is the most common. So yeah, so that way you should be memorized with all these, which will help you solve your questions. And I will end my video with a quote, which will be maybe helpful for a lot of you. So this is exactly how a life of a medical student goes. The quote says, "I gave up my life to learn how to save yours." So I'm sure if you cannot relate until now, you will relate in the next 3 months. See, I'm an FMG just like you, and we all have done our fair share of wilding out there. And during exams, we also did our reading there. Yeah, I'm not saying that we never read when we were out of India, but yeah, we have done a lot of, we have had led a lot, a very fun life compared to other students. So all I want you to is sacrifice your fun for next 3 months and just focus on all the important topics that I'm coming up with in the following videos. I think I will conclude this session, this series in I will conclude this session in within next week, because right now I'm also busy with my work, but I want to finish uploading this series in next week so that you have sufficient time to at least complete two revisions of all the topics that I'm talking about. So yeah, this was the first episode. If you like it, make sure you like and subscribe and share it with your juniors. And if you like and comment that will help this video reach other FMGs. So yeah, please consider doing that. It will just take some of your time. Just like and comment something. And also I will provide this PDF in my Telegram channel. So I want you to join and subscribe to my Telegram channel. I will post its link in the YouTube description. So that was all from my side today. Happy Sunday, and good luck with your upcoming exam. uh, and I'm sure you're going to make it. I'm sure you're going to make your parents proud, you're going to make me proud. So yeah, that was all from my side. See you in the next one. Please like and share and comment. Okay, this is taking a lot of my effort, but yeah, I want to do it for you. I want to do it for my friends. I want to do it for my juniors, and I want to do it for everyone who is watching this video. So yeah, like, comment, share, subscribe. Thank you so much. Have a good one.